So a 3-month-old baby was brought by her mother to the emergency room with the chief complaint that the baby was not feeding very well. She denied any fever, any vomiting, diarrhea, or any other complaint. In the emergency department, they did some blood work, they did a chest x-ray. It looked like there might have been a small pneumonia. So the patient was then started the baby on antibiotics, and because of the poor feeding, the baby got a nasogastric tube and was being fed through the feeding tube. Colleagues took over, and it looked like the baby was still having difficulty feeding when they removed the feeding tube, and so the baby was not able to be discharged home and continued to be fed through the feeding tube. But then the second doctor noticed that the baby kind of was getting a little bit lethargic, and there was some concern about the neurological status, and at that point they did a lumbar puncture and a spinal tap to rule out meningitis and started the baby on high dose antibiotic. So I took over this case around day 3 or day 4. So when I went to do my exam, though, I was kind of struck by my physical exam on the baby's exam, and the baby's face told me that something else was going on here. I had sort of a gut feeling that the clue was the face of the baby and the overall, appearance of the baby that alerted me to the possibility that there's something else could be going on. It's a pretty rare diagnosis in an infant that age. That the baby had constipation for about 5 or 6 days prior to coming in, and that the baby had also noted to be drooling when she was being fed, and she just was having difficulty actually sucking the bottle. The clue was the face. The face looked like a masked face, so there was no emotions, no expression. The baby just lay there helpless, and it looked like kind of classic for botulism because it paralyzes the facial muscles, so there's no expression. So when I spoke with the physician on the other line and tried to convince him that I think my patient has botulism, he sort of said that they get many calls like that every year, and without actual documented proof, there was not going to be any treatment. Now the treatment for botulism or infantile botulism is to give the antitoxin. So the cost of this baby big or the antitoxin for botulism is around $36,000, and that institute was not willing to. The baby had gotten worse in terms of the neurological exam had gotten worse. Now the baby started to have what we call ptosis, which is when the eyelid kind of droops. Back again and convinced this doctor and said, look, based on this exam, I'm pretty convinced that this child has botulism. At least they released the toxin. So we got that, and by the end of that day, we were able to give the antitoxin. Now, I still, even though I was fairly convinced that this was botulism, I still had a little bit of, doubt in my mind that I don't know if this really was or wasn't until you actually prove it. I got the phone call from the center, saying that we have your test results back. Does have botulism type B toxin was present in the stool sample. Within a matter of few hours had started improving. By next day we were able to take the feeding tube out, and her facial expressions and everything returned, and she basically made a full recovery and was able to be discharged from the hospital in a few days. So deeper as to how that baby got botulism, the baby's grandfather was a landscaper, and so he had handled that baby a few days prior, and so I think what happened was, the botulism spores were present, in the surrounding area, and so that's how through his probably the dirt or something under his nails that went to the baby, ingested the spores, and that's what released the toxin. So anyway, I think that just goes to prove that if you take a detailed history and do a good physical exam, you can definitely make a lot of diagnosis without needing, fancy tests and things like that. So infant botulism presents from the age 1 month to 12 months. And the initial presenting symptoms would be constipation, which is one of the clues, and then progressive muscle weakness from face down. So from head down, the muscle weakness starts. So the things that you would notice would be the eyes are drooping. So what is ptosis? The eyelids are drooping, poor suck, poor feeding. So that's one of the presenting features that my patient had in my previous video. So poor feeding, poor suck, ptosis, decreased tearing, decreased spit, so decreased saliva, and maybe a flushed appearance of the face. And then overall, a generally limp and ragdoll type appearance, and that's just from having a poor tone from the muscle weakness. Now, if this muscle weakness continues, if the patient is not diagnosed in time, what can happen is respiratory failure, because it will affect the muscles of respiration, and that actually is what causes the death if it's not picked up in time. Now, actually, there was a study done on this which showed that 50% of cases, even in the hospital, were missed. The diagnosis was missed. So, it's such a rare diagnosis that unless you're really thinking about it, you're not going to pick it up. So, how we make the diagnosis is by sending the stool sample, or sometimes we have to do a rectal swab, because these kids often will have constipation and don't produce stool. So you send the rectal swab to this California Center of Infant Botulism Treatment, and there they test for the toxin. So it's not a blood test, it's you test for the toxin in the stool sample, and that's how you get the diagnosis. However, like in my case, if you strongly suspect that this patient has botulism, the treatment should be started immediately if you're suspecting it that strongly enough, because the delay in treatment is what's going to lead to that respiratory failure. And then, once they get the treatment, that's called the baby big, which is the antitoxin for botulism. And then things get much better as soon as they get the toxin. In terms of prevention, I wouldn't worry too much about it, because it's such a rare disease. So many people garden outside, play outside. How many are really getting it? But it's probably always a good idea, if it's a baby, maybe good hand washing and, before they try to put their hands in their mouth. But again, I wouldn't worry too much about it. I mean, it's a fairly rare diagnosis. So that case discussion that I did wasn't meant to scare anyone. It was just a very interesting and eye-opening case. So I hope this helps. Thank you.